Hi everyone, Alison Acerra, registered dietitian here with MedShadow, and today I want to talk about how we can support our friends and family members who may receive a Parkinson's diagnosis. Now that we know that Parkinson's can be a very debilitating condition, and what we really want to be thinking about when it comes to food and overall diet patterns are ways that we can not only ease symptoms but also help to slow the progression of the disease. Now, there's a few key ways we can think about doing this. So overall, the Mediterranean diet has been shown to help slow the progression of Parkinson's disease. And so this really points to all of the anti-inflammatory benefits that we can receive from foods that are incorporated into this overall plan. And so this is really all about whole foods, minimally processed, lots of fresh fruits and vegetables, fatty fish, nuts and seeds, healthy oils, whole grains, right? So we're really minimizing those processed foods, canned foods, prepackaged foods, and really focusing on ones that we prepare fresh from scratch, adding in lots of wonderful spices and seasonings to make them delicious. So that's overall how we can think about an overall eating plan. We also want to be thinking about ways that we can support brain health. And so this really speaks to the role that omega-3 fatty acids can play in slowing the progression of Parkinson's. So overall, we want to be thinking about fatty fish as a great source of omega-3 fatty acids. Flax seeds are also a great plant-based source. And so omega-3 fatty acids are a fantastic support, to this overall eating pattern. We also want to be thinking about incorporating foods that are going to help support digestive health, because constipation actually turns out to be a really debilitating symptom for many of these patients. So we really want to be making sure that we're supporting the GI with hydration, right? Safe hydration, because sometimes swallowing can be an issue. So we might need to thicken those fluids to make swallowing liquids safer. But we also want to be thinking about incorporating more dietary fiber. And so we can do that. I mentioned flax seeds. It's a great way to introduce some more dietary fiber. We have hemp seeds here. It's also another way to increase dietary fiber in easy ways. We can add baobab powder or psyllium husk. These are all powders that can introduce more fiber into the diet. And so we can actually couple that added fiber with softer foods, right? Because again, chewing and swallowing can be challenging sometimes for these patients. So I really like smoothies because I think that they can incorporate in lots of incredible nutrition, lots of wonderful ingredients that can support overall health, that are also going to be safe to swallow. So flax seeds, again, are great to introduce into smoothies. I mentioned hemp seeds also have a great source of magnesium, right? We can be adding in spinach. Spinach is they're rich in sulforaphanes, antioxidants that can also really help with Parkinson's. Blueberries are a rich source of polyphenols, also antioxidants that can really easily be added to smoothies, and also introduce lots of wonderful antioxidants. Also all part of, kind of a Mediterranean approach to eating. So those are some tips that you can think about when approaching Parkinson's from a nutrition perspective. So we really want, again, as a wrap up, to be reducing inflammation. We can really look to the Mediterranean diet for its benefits there. We want to be supporting brain health with omega-3 fatty acids. We want to be incorporating more dietary fiber to help with GI health. And we want to be introducing soft foods that are going to be safe to chew and swallow for these patients. Okay, so if you have any questions, please don't hesitate to shoot them on over, and I appreciate you listening. Thank you.